Welcome, everybody. Thank you for joining us this evening. We are joined by Dr. Luca Sabatini, who is the Chief Medical Officer at Apricity Fertility Clinic, and we will be discussing expert tips on getting pregnant over 35. So welcome everyone who's watching back. It's great to have you here tonight. So I would like to introduce Dr. Luca. Could you tell us a little bit about yourself and Apricity?
Yes, okay. I'm not going to spend much time. I'm a gynecologist. I've been working in this field for the last 35 years. I was a medical student, fascinated in the field of reproductive medicine. I came to England, I did research. I'm still working at the university, educating and teaching medical student and postdoc student on the field of reproductive medicine. I work in the NHS as well as in the private sector. I'm an expert in polycystic ovarian syndrome, endometriosis, and IVF. I also joined Apricity about now 2 years ago because I was fascinated by finally an organization which want to shake and change the way we were been working in this field for the last 30, 40 years. You know, the use of technology, the analysis of big data, they're giving us new tools, new power in making the healthcare fairer across all layers of society, but as well as to make more approachable and more efficient and more successful. So Apricity is a different type of fertility clinic, does use remote consultation, which is now used almost from everyone, but Apricity started 5 years ago, and it was the first clinic really to introduce the concept of traveling the least as possible, but also we utilize algorithm, artificial intelligence. We share information and collaborate with some of the leading scientists in the world, embryologists, doctors, and we do research. So we're not just an organization which try to work in the private sector, but we're actually investing a lot of the revenue in try to improve the experience and the science. So we do a lot of work on non-invasive methods of selecting embryos, so without exposing the embryo to the risk of injuries. And we also developing a way to monitor patient by doing ultrasound and investigation at home, so the patient does not need to travel kilometers and spend a lot of time, but they can have most of the treatment and most of the diagnostic in the comfort of their own premises, their own house. And the results has been excellent. The results, Apricity does all the investigation, all the fertility treatment. We do work with single, individual, and couple, which they want to have all sort of spectrum of fertility, from going through the investigation, going through the process of freezing eggs and sperm, down to the process of having IVF with their own gametes and ovary, eggs and sperm, as well as using donor eggs or donor sperm or surrogacy. So we actually cover the full spectrum. Mm-hmm. And it's available in the UK, as well as now is available in Spain, and soon will be available in Germany and Italy.
Wonderful, wonderful. Great. So tonight we're discussing getting pregnant over 35.
Okay. So I'm going to start. Thank you very much, Eloise.
Yes,
so there is no doubt there is a social trend in getting pregnant later on in life. You can see from this graph. This is a report the age of a woman, a first, second, third, and fourth child. And we see that from the early 70s, there's been a trend in trying for a baby later on in life. So this is due to a social circumstances, changing the way we live, an increase, an improvement in the healthcare and in the social status of people. In the next slides, we can see that actually infertility is not so common. So we need to remember that if everything is well in your body, in your health, the chance of conceiving is pretty good, actually. You know, there are between 80 and 90% chance of experiencing a successful conception within a year of attempt. There is also something which we need to remember, that when people talk to us and say, oh, you are over 35 now, it's going to be difficult to conceive. 35 is not a magic number. So there is not just a cutoff, an expiry date beyond which you cannot conceive anymore. Fertility doesn't plummet. Fertility has a gradual decline, which starts in the early 20s and become more prominent, more important after the age of 30. Start at about 32 and become even more important after 37. So if at the age of 20, a lady, a woman, or a couple has about 1/4 of the chance of conceiving every month, by the time a woman reaches 40, the chance of conception is only 1 in 20 every month. And we will see in a moment why. The reason why we're focusing more on a woman rather than a man is because there is a biological difference, which I will explain to you in a moment. So chance of having a baby per month is 25% at the age of 20, but then reach down to about 5% by the time you're 40. So this is interesting slides. You will see this diagram, this pattern with a curve going down and a curve going up more as we go along during the presentation. And actually, this is showing the chance of having a baby in different age group from 20 to over 40, and the chance of infertility increasing as you grow older, and the chance of getting pregnant decreasing as you grow older. But again, it's not all a bad news. At the end of the day, if we know that 90% almost of the couple at the age of 20 will conceive within a year of attempt, by the time you're 35, it's over 50%, 50 to 60% of couple will conceive after a year of attempt. And by the time you're 40, still about 25 to 30% of the couple will conceive after a year of successful attempt. So 35 is not the age beyond which you will not conceive anymore, or you absolutely need the IVF. So there is other aspect to consider, and we'll see them in a moment. Okay, that is a very interesting slide, which I love it. You may not think in the same way. However, this is the major biological difference between a woman and a man. Men can produce sperm throughout their life. They may produce sperm which become worse in terms of quality as we grow older. Women, unfortunately, are born with a set number of eggs. So by the time a woman is born, has approximately 3 million of eggs shared between the two ovaries. By the time a woman starts having a first cycle, she's left with about 600,000. So every day a woman loses eggs. Regardless if you sleep, you enjoy yourself, you're taking a pill, you're having an injection, you still lose eggs. And the younger you are, the more eggs you lose. So we know that, for example, at the age of 16, a woman loses about 80 eggs every day. By the time she reaches 40, she loses 3 eggs a day. So you see, eggs are inside the ovary, they start growing. There is a mechanism which nobody knows how it works. And then they reach a stage where you see them on a scan, and we call them antral follicle. So everything before the antral follicle stage is not visible on a scan, but there's still something going on there. And by the time the eggs reach a stage where it can be seen on the scan, then it's got 2 weeks to decide if either carry on growing and get released, or it dies off. So in these 2 weeks, from become visible to the next 2 weeks to the ovulation is what is making the fate of that egg. And the remaining eggs that are not reaching ovulation, they will die. So that is where the problem is. So a woman is set to lose fertility at a given time in life, which is set by genetic, pathologies, and other things which we'll see in a moment. So which cause of a gradual decline in fertility, what we said earlier on, but also there are other important aspects. For example, if I was 37 years old, perfectly healthy and fit, with an ultrasound which is perfect, blood test analysis which are perfect, and my partner has a perfect semen analysis, it is very likely that I will fall in this 60% category that will be pregnant successfully within a year of attempt. On the other hand, if I suffer all my life with, for example, with endometriosis, or I have uterine fibroids, or I did suffer for bad luck of a chlamydia infection a couple of times in my life, it is likely that I may have some what we call comorbidity. So we may have other pathologies which they will add up like negative variable on an equation, which eventually will determine your chance of conception. So it is important at what stage in life to start seeing where you stand. Am I at 35 years young or 35 years old? Am I someone which has other problem beside what is impossible to treat, which is aging, that can affect my chance? And we can see at the end, I want to be fair. I want to say, look, the problem is not only for women, also for men. The little table shows you that if a man and a woman, or the age both of them between 35 and 39, try to conceive, they have about 29% conception rate every month. But if the man is 5 years older than a woman, the conception rate dropped to 18%. So as the men age, then clearly there is a negative variable related to the men, which affect the chance of conception for a couple. Okay, so this is what I was saying. There's another graph very similar to what I showed you before, which was showing you chance of conception and chance of infertility. Now I start talking about number and quality of eggs, because many patients ask me, oh, if I'm getting old, is it a problem only with the number, or also it's a problem with the quality of the eggs, or both? Now, unfortunately, it's a problem with both, because as you grow older, you lose eggs, but you also increase the number of poor quality eggs. We don't know if this is a mechanism caused by the fact that you're losing good eggs first and you are left with bad eggs, or if as we age, the mechanism of eggs development and maturity and maturation is become affected. But what we know that as we grow older, we see that the chance of abortion increases, and they will increase for a particular reason we'll see in a moment. So at the age of 20, one positive pregnancy test on the stick may miscarry. At the age of 37, almost 2 pregnancy on a pregnancy stick may miscarry. And at the age of 42, about 1 in 3 pregnancy may miscarry. So that is what is showing is that the percentage of good quality eggs. So the eggs are inside the woman's body and they are frozen in a specific stage of maturation. So when the eggs is about to be released, still has both copy of genetic material inside. So the men produce sperm with half of the genetic material and need to mix with an egg with half of the genetic material. So we create a new individual. So we each have 46 books. We call them chromosomes. So the men give 23, the woman give 23, and we got a new baby with 46 books of chromosomes. So the men produce sperm, which have 23 books. The woman still has got these eggs inside the ovary with 46 books. So by the time she's ready to ovulate and she's got the LH surge, then she throw away the 23 books and release an egg with 23 books. And this mechanism becomes defective as a woman grows. So we see that when we analyze the eggs released by a woman at the age of 28, about 25% are genetically abnormal. At the age of 35, 35% are genetically abnormal. At the age of 40, near 60% are genetically abnormal, and so on. So that is indicate and explain to you why, as you grow older, the eggs released by a woman is more likely to be abnormal, and therefore is more likely that the baby may suffer a complication, may suffer a miscarriage. So fertility decline at every age, regardless what you do. You decline if you try for conception naturally, but also even if you do IVF, the chance of conception, they decline. They decline as you age, exactly with the same pattern of a natural conception. So how long does it take to get pregnant? What we like to look at is statistics. The statistics say that 7 women out of 10 will conceive within a year when you're 30. It goes down to 6 when you're 35. It goes down to 4 when you're 40. So it doesn't really tell you very much. If you are 38 years old, it doesn't tell you very much that you absolutely will conceive within a year or 2. Okay, so it is important, therefore, that you consider your circumstances. So what you do, if you try actively for a baby and you are over 35, our suggestion is that if you're not conceived within a matter of few months, you should seek medical advice. And I wouldn't wait 1 year or 2 years. If you're over 35, it is good to do some tests, which we will discuss in a moment. But if you're not being successful, despite of having natural normal tests and natural ovulation or regular cycle, it would be logical for you to seek medical advice. Differently it is if you are 25 years old and you're not trying for a baby at all. In that case, really, you may want to consider perhaps freezing your fertility, but then you're not worried too much if you're not conceived within 6 months of trying. So how aging can affect the fertility of a woman? Aging, as we said, affects the fertility of both men and a woman. In a woman, an increasing age affects the pregnancy by increasing the chance of having high blood pressure, not dramatically, but statistically significant. So why? It's because probably the body has gone through many years of stress. The arteries are a bit more rigid, and clearly, as we know, as we age, we are increasing weight. So there is an increase in diabetes, there is an increase in high blood pressure in pregnancy over the age of 30, 35. But I wouldn't call it over the age of 35. It's more the increase is related to the aging. So there is an increase in high blood pressure, even in those couple of the age of 30 compared to those of the age of 20. So clearly there is an increase related to age, which doesn't start at 35 exactly. But if you want to be precise, there is an increase in diabetes, there is an increase in pregnancy complication, there is an increase in twin gestation. As you grow older, the chance of having non-identical twins increases because there is a mechanism where the human body releases more than one egg more often as you approach the 40 years of age. So chance of having fertilization of two eggs which are non-identical, creating two embryos which are non-identical and both implanted is higher. So, and also, as we said, there is an increased chance for a pregnancy to be abnormal. So, as we said, aging will affect the health of the pregnancy. So diabetes, high blood pressure, multiple gestation, which then they are linked to difficulties in delivering. So women above the age of 35 is more likely for them to have a cesarean section, for example. But also being an older mother can affect the baby as well. But it's not very much the effect of a woman age on the baby health. It's more the risk linked to the genetic of the egg, as we said. So the chance of having a baby with Down syndrome, which is when 3 copies of the book 21 are together rather than 2, so 1 from the man, 1 from the woman, and then there's an extra book which comes normally from a woman. Then you have a Down syndrome baby, or the other most common condition, again, genetically linked, which is Edwards syndrome, which is 3 copies of the book number 18. And so as a woman grows older, this mechanism of throwing away half of the book so that the egg is ready to be matched with the sperm doesn't work all the time. And when it's defective, the egg is left with one extra book. And when you put together this extra book with the books from the sperm, then is where you get something wrong. So what do you do? I mean, here, this is a $1 million question. You know, we are inundated with information from the media, vitamins, lifestyle. You know, it's easy to say to a couple or to an individual, oh, you should change your lifestyle. You know, how do you change your lifestyle? I mean, nowadays with work, busy school, busy whatever we do, you know, you cannot just go and live in a nice island with a healthy diet and sunshine and somebody working for you. So, but definitely there is something can be done. What is important is, for example, diet. Having a healthy diet does help. For example, if you are vegetarian, we know that you need to use some supplement. You know, vitamin B is something which is very often contained in meat, in animal protein, and therefore using some extra vitamins or vitamin, especially vitamin B12, is important. Folic acid is the only element which is so far has been demonstrated to reduce the chance for a baby to develop abnormalities, and therefore using the standard dose. Very, very often we get asked the question, how much folic acid should I take? The dose which is in the regular brand or more. Normally the dose in the regular brand is enough. Who need more are those individuals, those women in particular, which have a history of diabetes or epilepsy, or they take drugs which are cytotoxic. So that they need 10 times more. So they normally take 5 milligrams. Otherwise, the standard 400 microgram, which is contained in Pregnacare, is plenty. Reduce the body weight is very important because there is a very direct link between body weight and risk of high blood pressure in pregnancy, preeclampsia, cesarean section, and all the complications linked to the cesarean section. So bringing the weight down to a level where the body mass index is below 30 or around 30 is definitely beneficial. There is also an important aspect on this, that if you never conceive and you're hoping to get NHS funding, because up to the age of 42 nowadays, wherever you go in the country, you should be offered at least one cycle of free IVF. If your body mass index is above 30, you'll be automatically excluded. So again, it's a red tape which is being created to save money, which is discriminatory in my view, but you need to be aware of it, because if you're planning to have this help from the national health system, you may be denied just based on your weight. Smoking is definitely harmful. Baby from couple which they smoke or they are exposed to smoking, they're definitely smaller, they get delivered prematurely, and they suffer more respiratory problem. It's also, there is a link in reducing egg reserve and high level of smoking. So if you are an heavy smoker, is more chance that your ovary may suffer vascular injury and therefore may have less eggs than average. There is an effect in alcohol. Drinking 1 or 2 glasses of wine is not a disaster, but drinking a bottle of wine every other night is not great for your child and for your chance of having a baby. NHS recommend stop drinking completely. Again, I come from a country where a bottle of wine is always on the table, or at dinner or lunch, and if you drink a glass of wine, it's not a disaster. There's no evidence. Although some recent studies suggest that even a glass of wine a day is detrimental, but I would suggest that probably that is not the case. Stress can be related to infertility, but only if it's strong enough to stop your cycle, because stress can change your hormones and cause you to not to have your cycle, not to have your menstruation, not to have your ovulation. However, stress normally does not cause miscarriage. And we know this from study done in areas where there is a lot of stress due to war and where fertility is not affected so much. Exercise, of course, does help to keep your weight down, your blood pressure down, your diabetic risk down. So you need to eat a diet which is rich in whole grain, with good fat. I mean, again, I leave these slides for me not to go through the obvious. So when do you see a doctor? I would say if you've been trying for over 12 months, you need to see a doctor. You need to see a fertility specialist. And I suggest 6 months to my patients. You also should see a doctor if you have 2 miscarriages. Don't wait for the 3, as anecdotally said by the NHS. The number of 3 is set by the amount of funding. It's not because if you have suffered 3 miscarriages or more, is more likely. It's just down to the funding. If you have a genetic risk, if you have a family history of Down syndrome, for example, it's important to see a doctor early. Okay. What tests would you do? Okay. So tests are, again, I would do those tests at the very start. As soon as you're thinking that you would like to have a baby, test your AMH. Anti-Mullerian hormone is produced by the small follicle, the small eggs, which we have not seen on the scan yet. So those are eggs which are producing this hormone, and the level can tell you what is your window of opportunity. It doesn't tell you the quality of the egg. Don't be mistaken. A low AMH cannot predict the quality of the egg. The quality of the egg is more a ratio of your age, based on the diagram I showed you before, eggs related to your age. But the number is definitely related to the anti-Mullerian hormone. It's a simple blood test. Sometimes GP are happy to help. Otherwise, you can contact Apricity. Is not a very expensive and is a very important test to do. Ultrasound scan is important because at least if your uterus has got other problems. You may have fibroid, you may have polyp, you may require surgery before try for a baby. So knowing what your uterus and the ovaries appear and is very important. So it's another simple test, can be done by your GP or organized by your GP, or can be organized through your private doctor. Some condition can be visible on ultrasound. If you have endometriosis or if you've got a blocked tube, can be seen on ultrasound. Thyroid hormone, thyroid blood test is more important if you lost a baby, even only one, because we know that thyroid can affect the early implantation stages. And again, it's a blood test I would do once the pregnancy miscarriage is resolved, to see if you need any supplement for that. And the fallopian tube test in particular, if you have suffered pelvic infection disease or chlamydia infection. Okay, treatment option. Then I will stop to leave a space for question, I think. So medications, simple medication, which can be even monitored by a GP, clomiphene. Clomiphene is tablets you take for 5 days. Normally you start between day 2, day 3, or day 4 of your cycle. You take for 5 days, and the tablets give a message to your brain to produce an hormone which make you growing an egg. It's dangerous if you do without medical supervision, because you may release 5 eggs and get pregnant with quadruplets. But so when you use a Clomid, at least the first cycle, to monitor at least by once with ultrasound to see if it works, if it works properly, and then reassure you that in the future you can use the same dose. Intrauterine insemination we do mostly when a woman does not release an egg regularly. We sometimes combine with the use of Clomid. So we give a Clomid, we monitor with ultrasound the growth of the follicle, and then we take the sperm, select the best one, inject inside the uterus, the best sperm, maximizing the chance for sperm and egg to meet. Success rate of IUI is about 10 to 20% per month in the best couple. IVF is the most successful form of conception. 50-60% of couples up to the age of 30 get pregnant with one cycle, 30% up to the age of 35, 20% at 40, and then drop down. But I don't think I need to discuss about IVF. Probably all of you have read about IVF. Genetic screening of embryos is important for those couple or women which they suffer recurrent miscarriage after the age of 35. This is very important because sometimes they may have the tendency to always produce the same genetic abnormalities. Also allow us, among embryos which look all perfect, to screen which one is really the good one, which has got good potential. Unfortunately, it's expensive, but can actually give you an advantage. Egg freezing. If I was a woman today and I was less than 40, I would freeze my egg, because the technology is so good now that it does allow eggs to survive the thawing and then maintain the same fertilizing capacity of the time when they were frozen. So think about when you're 45, being able to use your eggs when you were 38. It gives you an advantage. And surgery, whenever there is an anatomic abnormality, but the most important part is get a good surgeon. Don't get treated by anyone, because there is a tendency between doctors to, for some reason, not to have an insight and not to, with some doctor, not everyone, but I think, if you have endometriosis, go to an endometriosis specialist. Don't get treated by anyone. So can IVF succeed in making you, restoring your chance of conception? You can see that success rate with IVF, the green line, using your own eggs, decline, regardless, whatever you do decline, because it's linked to the number and the quality of the egg. However, when you use donor eggs, so you're using eggs of somebody younger, and you use a donor eggs in a 32, in a 34, a 36, 40, 45, the success rate remains stable the same, because success is linked to the quality of the egg, which is linked directly to the age. So women which they've run out of their own reproductive options can still conceive successful babies using donor eggs. And we need to important to say that Eloise and I, we are 97.5% genetically identical. So is the nurture of the embryo more than the genetic? Very often I've been asked, oh, but then it's not my child. Of course it's your child. It's growing inside you, and your body will help the genetic material to express and develop. And considering, we share 97.5% of genetic material, and we use only 10% of it. So think how much of your effect input will be on the genetic expression and development of this child. I think what is important is that when you're ready for a baby, make a preconception appointment with a doctor, a specialist, hopefully, Apricity, have a discussion. If you are 25, there's no need really to be worried too much, but if you're over 35, what should I do next? This is very important. Mm-hmm. Because then people will be able to tell you, give you a very simple guide. Okay, you do your antimalarial now, you do things at the right time. If you perhaps may be taking medication which affect the level of antimalarial hormone, so you'll be given the right advice. I had patients panicking because they say, oh, my antimalarial hormone is very, very low. It was taken when they were taking a pill for 10 years. That was not the right time. So having this preconception advice and exchange of information is important. That's the reason why, if you wish to go in touch with Apricity, we have a team of experienced nurse, advisor, and doctor, which will be able to give you this information.
And the contact details are here on the page, so please do get in touch with the team, advisors at apricity.life. There's the phone number and the website as well. Thank you so much for your time today. It's been truly insightful, and thank you to those who have joined, those who are watching it back. We're very, very pleased to have had you here today and for answering all of these expert questions. So thank you, everybody, and please do get in touch with the team.
Thank you very much, and really been a pleasure. And please get in touch. We'll be very, very happy to help. And thank you, Eloise, for your help.
Of course, lovely to see you. Good evening, everyone. Thanks.
Bye.
Bye-bye. Bye.